Hi, I'm Diana Stewart. I'm a public health educator. Welcome to the Love Her Protector workshop on the COVID-19 vaccine during pregnancy. We felt that it was really important to share this information with those of you who are pregnant or thinking of becoming pregnant about the benefits of having a COVID-19 vaccination, and to also share with you some of the things we've learned, some of the facts about the vaccination involving the virus, about the benefits you receive from having the vaccination. We'll also talk about some of the myths that have circulated around the vaccination and talk about how you can get the vaccination. First of all, let's go around and introduce ourselves. Is this your first pregnancy, your second pregnancy? What brought you here today? What are you looking to learn? And then also, let's just set some ground rules and make sure this is a place where we can share our thoughts and feelings and learn about the vaccination during pregnancy, but be respectful of each other and how each other feels. So first of all, let's just talk about some of the myths that have circulated and been out there that you may or may not have heard about. There was a great fear and a misconception that the vaccine could change your DNA, but mRNA vaccines cannot interact with or change your DNA. So you would be the same as you were before after you've had the vaccination. Also, the vaccination does not contain a live virus. So when you receive the vaccination, you're not receiving the virus. The vaccination does not contain a microchip or tracking device, so we can't follow you around after you have had the vaccination. This was misinformation that spread a lot of fear. Also, there was another myth about the vaccination, but it does not make individuals magnetic or Bluetooth compatible. Cool idea, great concept, but just not possible because the vaccination contains no magnetic ingredients or Bluetooth technology. Also, with the hundreds of thousands of cases throughout the world in the different ethnicities, different economic groups, just different levels of health, they were able to do a lot of studies and gain a lot of information. And what they were able to discover and determine is that it shows that the vaccination does not cause infertility or miscarriage. Some of the facts about receiving the vaccination is that they are safe and effective in preventing sickness. Pregnant women are at a higher risk, 2 times higher risk of having severe illness that actually involves hospitalization and intensive care, as well as those who adverse and worse outcome is death if they haven't received the vaccination and contracted the COVID-19 virus. The vaccination for COVID-19 also works against the new variants, and it also prevents the transmission of the virus to others. Pregnant women who have gotten COVID-19 have had severe complication because the immune response is lowered during pregnancy, and it makes it harder to fight off infection. The symptoms of receiving the vaccination range from mild to moderate. You could have a fever, headaches, muscle aches, and just generally feeling tired. Also, it has been determined that you can receive the vaccination and it's safe to receive at any trimester of pregnancy. So what are some of the benefits of receiving the vaccination? Like, why would it be a benefit to you to receive the vaccination? Well, not having long-term effects would be a great benefit. Having your immune system response strengthened is a safer way to build your immunity than getting the disease. One of the amazing benefits from receiving the vaccination is that the mother builds antibodies that are able to be passed to her baby without complications. The mother is also protected from the harmful effects from the virus and from the possibility of death. So, how does one go about getting the vaccination? Well, starting in March, the vaccination will be available in doctors' offices, clinics, and hospitals for pregnant women to receive. You can receive both doses during your pregnancy and or a booster, as well as one of the amazing things is that it's free, so there is no cost to you whatsoever. Also, we've set up several ways that you can contact us to ask us any questions you have. After we've done this workshop, if you still want to have more information, you can always contact us. Also, this number, 801-789-1234, can be used to help you set up appointments. If you're not sure where to go or you just need some help setting up an appointment, we could definitely do that for you. We also have a website set up that has a lot of information on a lot of the data that's been gathered, the information that's been received. The University of Utah is actually doing a long-term study with 14 other universities, and they've compiled a lot of information that's just really great to have to help you understand and feel like you're doing like the right thing for yourself and for your child. So the website that we've set up is https://sites.google.com/view/loveherprotector/home. I hope that by being here today and listening to some of the things we've shared during this workshop, you feel more at ease and will be able to feel confident that when you get your vaccination that you're doing the best thing for yourself, so that you can have a good quality of life, and also that you can share that little extra bit of bonus of having antibodies given to your child. Thank you for coming today, and take care.